Epidemiology of the esophageal cancer is defined by its substance viability as a function of histological type, geographic area, gender, race, and ethnic background. Because of the recent increase in incidence rates of adenocarcinoma, especially in Western Hemisphere, where the incidence of esophageal cancer now exceeds squamous cell carcinoma. So adenocarcinoma exceeds now squamous cell carcinoma. Epidemiological studies are now distinguishing between histological types when reporting results. High incidence rates of squamous cell carcinoma includes Turkey, northern Iran, southern republics of the former Soviet Union, and northern China, where incidence rate exceeds 100 per 1 lakh person per year. Incidence rates of squamous cell carcinoma may vary 200-fold between different populations in the same geographic area because of the unique cultural practice. Esophageal cancer is relatively uncommon in the United States, with a lifetime risk being diagnosed with the disease remaining less than 1%. And the recent year, there has been a slight decrease in the incidence rate on an average of decrease of 1% of each year from 2009 to 2018. It was estimated that 19,260 new cases would be identified in the United States in 2021, with 15,530 patients expected to die of the disease. And globally in 2017 there were 4,73,000 new diagnoses of esophageal cancer and 4,36,000 deaths. Although over the period of 1990 to 2017, a standardized incidence of esophageal cancer decreased by 22%. Due to aging and increasing population, the total number of new cases of esophageal cancer has increased to 52% over the same period, and death increased by 40%. So age standardized incidence rates are essentially equivalent among the African American and Caucasian men, although the predominant histological type in African American men is squamous cell carcinoma. Incidence rate of African American men peaked in early 1980s. Since then, there have been shown a decline to the current rate of approximately 5.8 per 1 lakh person year. Incidence rates among Caucasian men has increased up until 2000 and reflecting marked increase in the incidence of adenocarcinoma of the esophagus more than 400% in the past 2 decades, but now has stabilized at the rate of 7.8 per 1 lakh person year. Although the incidence of esophageal cancer in Caucasian female is lower, that is 1.7 per 1 lakh is lower than that in Caucasian males. Rate of adenocarcinoma have increased in women more than 300% during the past 20 years. Similar trends have been noted in Western European countries, and this trend of increased incidence of adenocarcinoma of the esophagus has paralleled the upward trend in rates of both gastroesophageal reflux disease and obesity. So steady decline in esophageal cancer mortality has noted since mid-1980 in the non-Caucasian US population, where a marked increase in mortality was noted among Caucasian men and women during same period. And this mortality among men, that is 6.8 per 1 lakh, are marked higher than women, that is 1.4 per 1 lakh, regardless of race. Although survival rate for all the esophageal cancer patients are uniformly dismal, regardless of race or gender, 5-year survival rate, relative survival rate have increased significantly improved since 1970. Based on surveillance, epidemiology, and SEER results, population-based tumor registry reporting, and there is no survival difference related to the cell type, squamous or adenocarcinoma.